really high for me? Okay, and then 1, 2, 3, 4.
This has gotten into
6.
CMS?
Have not gotten into CMS.
Oh.
Yeah. This has gotten in.
Oh,
right?
okay, awesome.
And then
Good.
6 of us have not gotten in yet. Okay, and for the 6 of us who have not gotten in yet, have we all gotten in touch with people? They've said we're waiting now. Okay, and everyone's gotten that 7 to 10 day message. And I think we're on like day 5. Yeah, what's that?
I haven't gotten like the 7 to 10 day message. They said that like they're doing like an interview.
Okay.
They sent them all my information. I don't really know where I am in that process.
Okay, we talked on Thursday, right?
Yeah.
Had you sent it then?
Yeah, I sent it. I went on them yesterday.
Okay.
And then that's when they were like, okay, we're gonna get you set up for like the manual identification.
Okay.
Okay.
So just
Cool.
yesterday. Okay, so hopefully we'll hear back in a little
If
bit.
too long goes by, then just definitely follow up, but hopefully you'll hear back soon.
I do want to show you all something. Sorry. It's okay.
Are you gonna show them the PDF?
Yeah.
Okay, cool.
I did want to show, we had mentioned last week that there are PDF versions of, the information that you'll have to do on the CMS website. And at some point you'll have to still go through all the modules, right? So this is not gonna be able to replace it, unfortunately. I wish that we could do that for you. So you'll still have to click through every slide, but if you want to get started on some of the information, I just typed in CMS CAC training modules, and it was the first link that says Navigator and Certified Application Counselor courses. These are the modules. They're just not numbered, but we started with Health Coverage Basics and with the Affordable Care Act. So that was 1 and 2, 3, 4, 5, 6, 7, 8. So those are the 8 you need. They are incredibly dense documents, like
They're literally the
hundreds of
modules in a
pages.
PDF. So
Yeah, they're like hundreds of pages long, so please don't read through all of it. But if you want to just start, looking at stuff, or if you're like, I really want to look back at the ACA information or the healthcare basic stuff, you can at least get started. And this might be just a nice resource for you later on too.
and they have like answer explanations and stuff like that too. So
Cool. Does
yeah.
everyone have that website if they want it? Just CMS CAC training modules. We'll try to put it in the email too.
Yeah. Okay, cool. So basically we're on training session number 3 today. So you guys have gotten through the first 2 trainings. And then we have 2 more after this. The 26th one is going to finish up the modules. And then our last training session will be stuff that isn't covered in the modules, but is still very, very, very essential to know before you go into clinic. So yeah, just again, all the trainings are mandatory. If for some reason you aren't able to come to one, please let us know as soon as you can. And that way we can get you prepared and everything. But yeah, that's looking ahead. The agenda for today, we can take any questions that you may have lingering from modules 3 and 4. We're going to go over a couple more volunteer requirements that we have for you guys. None of them like too much more than what you're already doing, but some things that you'll need to do, and review modules 5 and 6, all of that content. And then we're going to do some practice at the end, some group discussion and activities. So we already talked about CMS access stuff. Any lingering questions from modules 3 and 4 that you guys want to ask really quickly before we dive into things?
With a small disclaimer that was a really good.
Yeah.
So if there are questions, hopefully they'll get answered today, because we're gonna do a lot of practice and then kind of as we keep going, but any.
Okay, cool. Well, just let us know. And here are the additional volunteer requirements. So we have an expectations document, like volunteer expectations, that we're going to have you guys sign and send in to us. So that will be provided to you. And also, you have to be HIPAA certified in order to volunteer with SHAC. So some of you may already have HIPAA certification, but we need to actually have the certificate submitted, and it needs to be recent. So you need to have completed the HIPAA certification, I think, within the last year, right? So yeah, make sure you do that, because we're going to be using like an actual EHR in clinic called like Practice Fusion, where you're going to have access to like patient information and stuff. So you need to be familiar with HIPAA and all of that, which we actually covered stuff related to like PHI last week, all very relevant for in-clinic stuff. And Practice Fusion, this is the EHR that I just mentioned. It's where we monitor all of like the patient encounters that we have and stuff like that, take all our notes when we're talking to a patient. And this is going to be activated during your first clinic. Yash and Grayson, the training coordinators, they're going to be making short videos about the different functionalities within Practice Fusion. So like how to find I don't know, make an encounter, how to use a template. Yes, the templates are very key. Things like that. So make sure you watch those videos whenever they send them out. And then lastly is the Safe Zone training. So this is stuff related to like LGBTQ information, like things that's important to know for like, I don't know, like, yeah, do you want to elaborate?
Ask again. Yes. Workshop, and it was really, really wonderful. And unfortunately, there wasn't enough interest in the clinic. We have a lot of, sorry, I know that, yeah, thank you. So we, as you can see, had a lot of interest in these workshops, but the entire track did not, unfortunately. So they stopped doing those trainings. Of course, Safe Zone is or the LGBTQ Center does these Safe Zone trainings, but currently they're postponed. So what I was going to say was that we will give you more information on that as we get information. Maybe we can chat a little bit if you know anything further about if they're going to come back in the near future. Yeah, we don't know when. I'm thinking it's probably going to be a next semester thing that we have to do. But if anyone else has any other resources, please let us know. It's really important to have this information because we have a lot of clients who come for our gender affirming. We have a really wonderful clinic, and so it's just a really important topic for everyone.
Thanks, Sarah. Yeah, this was a required training back when I was volunteering, but like Sarah said, so definitely a lot to benefit from. Okay, any questions about this list? Okay, yes. Yes, so the follow-up email for today will definitely have all this information. Yep.
We don't want to throw it at you.
Yeah. Awesome. Okay, so module 5 covered a lot of important things. All of this is going to be related to the actual marketplace, which you guys have all gotten a glance at this point in the previous trainings. I think we've visited the website, you guys have seen it, but today we're going to actually go through how to create an account. We're going to go a little bit more into the plan categories, talk about what these acronyms mean, as well as discuss anecdotes and have you guys actually navigate the marketplace yourselves. And then do what the marketplace calls window shopping, where we browse plans, enter different search criteria that are important to the patient and stuff like that. So hopefully you guys will get pretty familiar with how to navigate the marketplace by the end of today. And Zara, is this where you wanted to? Okay, cool. So the first step in marketplace things, making an account, is identity verification. And so this is things that you guys have gotten familiar with because of CMS, which is like driver's license, whatever, and like social security card, just stuff to prove your identity. So this is going to be important for the patient to provide when creating an account. So, and whenever you're actually like doing it, all of this stuff will be prompted. So you'll know what you need to submit. But yeah, so this is a key component. And there's this kind of list that you can follow on how to assist patients broadly with navigating everything. And the first is going to be filling out the window shopping tool questionnaire as accurately as possible. So this is the thing that we looked at. I believe it was one of the last two, where you enter your zip code, you enter your estimated income, household size, stuff like that, just to get a brief screening so that they know which plans to present to you. And then you evaluate what is presented after you submit that questionnaire. So all of the available primary tax credits, stuff like that. And then last week we covered how all of the plans presented to them are going to be qualified health plans, qualified according to the Affordable Care Act. And so then we're going to look at those plans that are qualified and see if they actually meet our specific patient's needs. So if they have a specific primary care doctor that they know that they want to visit, you can look up and see if that plan, if that doctor is within the network. Hospitals, prescriptions, you can look up all of that stuff to make sure that this matches the patient's needs. And then you kind of compare and help them navigate all of the health plans that they're going to be presented with, because it can be pretty overwhelming. I do think healthcare.gov does a pretty good job of making everything look pretty clear and streamlined. But like we've said many, many times before, all of the information that are going to be on those pages, a lot of the definitions the patients aren't aware of. You guys are going to have to explain what a premium is, what a deductible is a lot of the time. And so that's kind of the big, I'd say, number 4 is the big one here, where you're helping them look through the plans, explaining what the different things mean to them, so that they can make a very informed decision about what they want to enroll in.
And I just to add something to that, it's a good idea to not assume that someone's level of knowledge on any of this, right? And what I mean by that is, I like to approach patients by saying, what do you know about, or what do you know about the hospital? And let our patients tell us what it is that you know about. And then we can help them, yeah, okay, that's exactly right. Perfect, that, you know, a lot about this. It's just a bad idea, in my opinion, to assume that people don't know this stuff and then sit there and type it. Right, because what chances are people will find out exactly what all this is, and they get to that to kind of help them feel it.
Definitely. And then, so after that, you're going to help them select a coverage plan. If they find one that they're like, wow, this sounds great, I feel like this matches my needs, everything like that, then we actually help them to enroll in that plan. And this can all actually happen within one sitting. So there is a lot of like follow-ups that are involved, and sometimes it's definitely necessary for Marketplace, but this whole list that we're describing here can happen in one encounter, just going through Marketplace stuff. And yeah, you can help them select coverage and enroll. And then you're also going to review and confirm health/dental coverage choices before signing the application. This is a big point. You want when they're enrolling for them to be very familiar with the plan, know exactly what they're enrolling in. Hopefully we're going to be dealing with patients where the primary tax credits should be making them obviously should be making the cost pretty low. But even then, like this is still like going to be the coverage that they're relying on. So they need to know what they're getting themselves into, basically, even if it doesn't seem like they're investing a lot of money into it, but in some cases they will be. So yeah, just make sure you go through the summary of benefits, stuff like that, and the patient's aware of everything. Any questions about this slide? Okay. Is this blocking you guys too? No. All right, important questions that you should ask. So number 1, does their employer already offer health coverage? This is a really important one, because a lot of jobs do offer health coverage, and they should be informing their employees of this, obviously, but it's not necessarily true that just because their job offers health coverage means that they know about it. So you want to ask them this, see if you can help them get more information about that, because those plans offered by the employer aren't always the best, but they could be. You don't know. So if it's an option for them that they can look into, they should know. Mm-hmm.
Because if the employer offers coverage that does not meet that need, the coverage is
Second one is, this one's pretty obvious, but have they already started the FFM federally facilitated marketplace, I think is what that stands for, eligibility application process, because then you'll kind of know where to direct the conversation if they have or have not. Number 3 is huge. Who needs coverage? Are they applying for just themselves? Do they have children? Do they have a spouse that we also need to think about? Is it just a few people, the whole family? These are all some of the first questions that should be asked whenever you're talking to a patient. And then again, I kind of emphasized this on the last slide, but what health plan features are the most important? That way you guys can check for them. And have you thoroughly met and understood your patient's needs so that you can help them look through the Marketplace stuff with like complete awareness of what they're looking for. And last but not least, explaining to the patient all of their options. We are not making any decisions on behalf of the patients. We are not pointing to a plan and saying, this is your best option, because I don't think any of us will ever feel knowledgeable enough to do that with complete confidence. It's not your decision. Ultimately, it's their decision, and you're just allowing them to make the most informed decision possible. Yes, please.
I'm just for that for myself. But when I think often and it's kind of kind of say, okay, I can't take these two claims. What do you think? Do you have any ideas on how you fix that? Yeah, absolutely. I love that. You just be like, okay, so let's say you go through these pros and cons again, or let's look at those priorities that you established and let's see which ones are needed. If it comes to it, what's another priority? Yeah. You can explain that, like, whatever options you have in front of us are specifically tailored to that. So you need to do maybe advice is not helpful because what's good for you might not be good for you. So we need some more time to sit on it. We'll we would have to consult with our therapist, first. That's always an option. We can always like come back and see what you think about it. But again, like, you know, we can kind of reinforce that. Like, I'm here to assist you, not like exactly. Awesome. I mean, I did.
Mhm.
Perfect. Great answer. And I think in fact, I've myself done that exactly. For taking two plans and maybe or documents, for example, and there's those things. You can compare on help to that as well, but this kind of very specific things that you compare and you have things you can do it side by side. What are some other resources you can pull for them to look at things and do every detail in that plan?
Yeah.
Summary benefits. Put those. Yeah, and just going back to that's okay. It looks like this is a difficult decision for you right now. Let's talk about your priorities. Let's talk about these options again. And at the end of the day, this is your decision.
Yeah.
More like big stuff. Is that exactly what? Isn't there like a specific person like contact that's like more like yeah. You mean like generally or like by each plan? Like by each plan. Yeah. You just call the plan, right? You can just like that's where our Googling skills come in. Like we look up resources all the time.
All the time.
You can go on their website, you can call if they have like extended hours that are into the evenings or on, and you can just call with the client and say, hey, looks like they're open right now. Do you want to give a call and ask the text number?
Or call for them on the next day. Yeah.
And then you can also call the CMS. And I think you should probably have that phone number somewhere pretty accessible.
Yeah.
Well, look, it should be somewhere in here, but you can call lots.
Mhm. And I do love what you said about not rushing the patient. We're not there to get them through the process as fast as possible. You know, if it's something that they want to think on, encourage them to do that. Yeah, this process doesn't need to be rushed. So that was a good point. That is, yes, a topic for a future training. We're going to be going deep into the interpreting stuff because, yes, there are interpreters, not for every language in the clinic, but for a lot of the more common ones. We definitely have Spanish interpreters, usually Chinese, and we have, we sometimes have others.
But something other, like the Burmese we have passed.
One time someone interpreted Russian for me. I don't know when that was. Yeah. Yeah, but working with interpreters is a very important topic that we'll be going into more.
I just want to add on the, you know, we have one of the few branches, I'd say, that does follow up with it. And we're going to talk more about that process, but we take that very seriously. It's something that we still have a lot of work to do because at the end of the day, this is not our full-time jobs, right? We're all students, we have lots of other things going on with volunteers. So we want to we're going to continuously kind of build our leadership team, continuously kind of build a follow-up process that is beneficial for the patient and efficient for us. But that is something that is very, very, so we will call our patients the next day or 3 days from now, whatever works for their schedule. We'll get on Zoom calls, we'll have them come back and visit, right? We'll work with whatever their needs are, but we do not rush them through their process. We do communication after communication. I had my very first person who I got signed up to the marketplace. I think we probably worked together for a month, and it was phone calls and Zoom calls and meetings in the clinic, and eventually we got this.
Yeah, I would say like 98% of the time, nothing's going to happen unless you do follow-ups, like a follow-up call like the week after. And I don't even mean like at some point in the future. I mean regular follow-ups after that initial encounter. Like 99.9% of the time that's going to be needed in order for them to end up with whatever you guys are seeking, whether that's a marketplace plan or Medicaid or financial assistance, which we'll be talking about. Follow-ups are like a very key aspect of our role, which is what we're going to also go in deeper in our last training. Okay, any other questions about this slide? Cool. Why isn't it letting me? Oh, crap. Okay, yeah, final thoughts here. Let me see which ones of these we haven't already talked about. Second, yeah, isn't it unless they're health insurance? Yes. This is a big one. Before the patient kind of is off on their way with their plan and stuff, you should make sure that they're aware that their enrollment isn't complete until they pay that first premium before the due date. So this is going to be really important. They shouldn't let that deadline pass them by. So make sure they're aware of this so that they don't miss it. And if they do miss any premiums after that first month, there's a possibility that Marketplace will cancel their enrollment unless there's a grace period for that. So you should also emphasize that to the patient. They should know that they should try their very best to be meeting those deadlines. And yes, this last point is really important too. The application information needs to be accurate. It needs to be as accurate as you guys as a team can make it. So make sure that you're really completing everything directly alongside the patient and having them enter the enrollment information themselves. Obviously help them where need be and answer questions and stuff like that, but make sure you're making sure it's as thorough as possible and directly answered by the patient. Yeah.
What are some ways that you can kind of have that more successful last little bit? Like you're thinking you want to start the application, what's the next? Hey, that ain't quite good. If you're asking like how to ask them to start the application. How to ask them to start the application. Kind of what I'm getting at here is you can always say to your patient, here's my laptop, would you like to try? Would you like to you get explicit permission from them? You should never have your laptop like facing you.
I was just about to say that. This is never how it should look like, where it's like, I'm the patient, Zara has her laptop. Like, they should see what is on your screen and be filling it out with you. Yeah.
And Sabrina is like super excited to do some practice scenarios today in our last session, so we'll talk more about that. It's really important.
Mm-hmm.
Good question. Yes, you are, and that's something on the execution document that we expect you to have as part of the process.
Yeah, and a charged phone because of things that we'll be talking about in the last session. Yeah. Okay, cool. Any comments, questions, concerns about this slide? Oh, very good point. Yeah. Yeah. And people that I've been helping with before have been scared at that part because like I'll be showing them that their plan is 0 and then they're like, why do you need my credit card info? But they still need the credit card info. So yeah, just comfort them in that situation. What's up? From what I remember, the screener usually asks if they're working with one of us, it says who, like, are you working with any, and then you just type in your name. So I feel like that's usually how they account for it, because it'll say, is anyone helping you with this application? And then you'll select your name, or you'll select, I think it says certified application counselor as an option, and then you put your name in.
It is like best practice. to suggest, like, here is my laptop.
Yeah.
And then if they're like, oh, I didn't bring my reading glasses, which is usually something you'll consider. And, or like, you know, could have a Korean, right? And, but we'll look into that, but that was not, it might also be on our consent one. Maybe that's something.
Good question, though. Okay. Yes. Well, I think with that, it's like, because they kind of need, they need to have their credit card on file in case, because as we've described, you can have a $0 premium and then other costs still come up. So it's a $0 plan and they're not going to be charged for any premium, but that doesn't necessarily mean there could never be any sort of cost associated with their plan. And so they still need to have their credit card on file.
This is essence based on how we think that they're gonna rate that year. But that's a contingency. So now you're paying at the end of the year with actually $750 every month.
Okay.
That was a Grayson's edition, can't be here today. We really wanted Dora to be in here.
So let's go.
Ready?
Yeah, sure.
So what we're gonna do now is we're gonna get you talking, moving, working with people. How many do we have in the room? Perfect. Okay, so divide up into groups of 3, and you can kind of let's see, we can have one group like in this vicinity, one group over there, one group in the middle right here, one group in the back middle, and one group on the left front, and one group on the back left. Okay, so divide into groups of 3. We're gonna give you a scenario, and we've written the scenarios down. Everyone sees that right on your guided notes. We'll give you 1, 2, or 3. And this is the task. So we're not gonna ask you to act it out right now. Definitely, I mean, if you want to, sure, but I just don't think that that's what we want. We're not building our acting skills here today, right? We're trying to build our critical thinking about how you would actually work through these patient scenarios. So we have intentionally loaded a lot of different elements into these scenarios. We really want you to think about what it is that I would ask the patient, what they start with, what are some nuances. Oh, the patient mentions this is what we should do. Have one person take really good notes. And Brina mentioned something as well when we were talking about having a note taker, that taking notes is a really big part of your job. You have to write really detailed notes. We call it the chart at the end of the night about your patient encounter. And that chart needs to be so legible and understandable that if someone was not in the room, they would know exactly what it is. Right? Yeah. We try to do that by having you switch with someone else, reading it, and seeing kind of where the gaps are, right? So practice that type of thinking, being super thorough, really thinking about all the nuances. Again, you can make up things like, oh, if my patient says this or has this situation going on, this is where I would go. And if they have this situation, this is where I would go. Okay. You then want one person to present, and you don't have to present everything that the note taker writes down, but we'll kind of give you some prompts and questions. There's going to be 2 groups for each scenario, so at the end we'll kind of gather some information from those groups and then share out to everyone, and that way you can take notes on each of these scenarios and then out there. Cool. So where are our groups? I have one over here. You know, just go ahead and divide up. Yeah. Yeah, perfect. And then 1, 3 back here. 1, 2, 3. Perfect. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Great. So, do y'all want to sit over here? Or someone over there, and that's a lot of people over there. Whoever, yeah, whoever, someone can come, like, there's, look at all this space. Let's do Actually, this is three, because we're gonna have one person, one of us is gonna stay with that. Josh, which scenario did you want? You're in let's do one. One and one. And then two and two. Sorry, you've already got started reading, that's okay, now you know what the other students are. Three, do you wanna work with that?
So which group
One
is
and
which?
two. Did I say one, Alexa? I think I said one for these two groups up here and two for those back.
Okay, and then this is three?
Yeah.
Okay, I can open as a person.
Okay.
Again, it doesn't have to be one person, but think about it. We have listed the healthcare.gov website at the bottom of here. You will need that. I didn't get that pulled up. Halo, red. Yeah. This isn't even nice. And he didn't do it. They're not afraid about it. I do. I don't know. Yeah, what's wrong? Having quick like yeah, they're having regular we're gonna have like but they're because the biggest that they're they'll pay it off. Because they're going to be paying for diabetes. Yeah. Is there anything there? First thing first, we already got that they might qualify and it said they what else do you think is gonna be involved? Oh, it's like employee. How many people are first aid actually? What else? You were about to say something. How many people are in business? Is business? Oh, yeah. But what if it's all business, we already do that, the coverage, the certain. Yeah. I mean, like, different insurance. Well, so why would you, what information are you getting back?
Yeah, so like, basically the school is like, and there's for insurance, you can pretty much assume that their employer would give themselves.
Yeah. Yeah, I think that-
So, yeah, I mean, I personally heard that, but I was thinking.
Okay.
That would be.
Okay. Like, what is? About like.
So silver is just categories, how we would know. Okay. Do you ever hold out for-
That's like a concert.
Yeah, so that's one key component of the, silver plan is that you have introductions, but in terms of just rating, it's just one within the rating, like rating. So, that's how we get important. One of the along the market. Saying how to label as one of the, it's on. For, yeah, for a specific, like, you wouldn't be able to put diabetes, but like, you would ask them, I know you're good, I know you're good, you would say what medication are you taking? And if they have a certificate provided that they like, doctors, either diabetes, checkups, or things like that, or like that. Yeah. So you guys are asking all the right questions. Yeah, yes, yeah, you should definitely ask that. They did just move, so they'd probably say no. Yeah.
You would see
Oh, no, but it's too long. But I mean, especially the things really for the news for the everything's got that strategy that they have. One thing that's even also say show some. Sorry, what question? Yeah, they probably know. And then kind of look through like a whole, yeah, there's some that but like a lot of times now, it's definitely they know those. Absolutely, yes. Okay. Well, it depends. Did they say they're both looking for coverage? Yeah. Yes. And. And here the asking. So if they are not seeking coverage in this plan, then it's generally no. Okay. However, that and they have X amount of feet, so that X amount of feet for themselves, it's divided against them, and they're like, so that's if we did it, and for those defendants, that would be really problem. Right, and then they're not, you know, qualified for primary, it's not really making. So that would be a situation. And even in this case, they could also help him because he has, let's say the needs of the whole work is, okay, but it's not because it's two, then you would have to that. Right, because that makes sense, but he's supporting that. Okay. Yeah, I will say. Thank you. Also another thing, because I don't want you guys to confuse about the thing, so quickly, usually, okay, so we're gonna put under household, all of the people now, right, so there would be, for what is the household plan for the the only reason I say that is we're just talking where it becomes a little less clear about how we're defining the household, but for my purpose, it's definitely, you know, if they are married and in house together, that's all they're on the house. Yeah, I didn't want you guys to know. It's a little private. Yeah. Before you let's see, so does everyone some I mean, of course, none of us are perfect with our answers. That's all I would say. None of us have completely written down everything that we need to say, and you would be working in a team anyway. So this in a clinic situation, you have a lot of different minds working together on this situation. Does everyone have at least like 3 things they consider? Let's start. All right, we're gonna start with. Should we do 1 or 3? Who feels more ready to go? Okay, really quickly turn to the first people and just figure out who's going to speak. I know that's always a little awkward. Just try to figure out quickly who's going to speak. And you don't have to have just one person. You can add on if you need to.
There's someone on healthcare.gov where you can filter for plans that include dental, right?
Almost none in
I know,
Cliftonville.
almost none do, but isn't that a button? Or is it not? 'Cause I remember it- But I might be
I
wrong.
don't think so.
No? Okay.
But
'Cause it would
let me,
probably be on that filter page and it's not, so.
it's not, okay, then
Yeah.
it's, I don't think they have. Okay, so let's start out with group one. You all okay with that? Yeah, group one, team one. So your scenario is up on the board just in case the other groups haven't read it. Benito is attending the clinic for the first time during his March visit, and he has just moved from up north and brought with him his small business coffee shop. He's looking for insurance for himself and his partner, Bert. His partner mentions that he wants eye care for their insurance and that they would like a very comprehensive coverage to support Bert's diabetes and Benito's regular prescriptions, and especially liked their silver plan that they had in New York because of the added savings. They are not super worried about the cost of the premium. All right, so let's hear what you all were thinking. I know it's like, there's so many places we can go, but what's maybe one thing that came to mind for y'all?
Just to start off, we would ask for like Bert's age and like their household like income. In general, like if Bert's also making money and then like how much they make from their coffee shop. And then you'd also ask like how often they think they would end up going to the doctor and like what like meds they would want, like they need, and that so we can include that. And like I know they just moved, but like preferred doctors they maybe like. And then we'd also like inform them of special enrollment and like try and screen them for that.
Yeah. Okay, let's start with that. So excellent. So you said special enrollment, right? Because if we were in March, our clinic is basically going to all of us are basically going to shift into an off-season protocol, right? So we're going to do Medicaid and we're going to do financial assistance for the most part. But that's especially when we as a group need to be really aware of these special enrollment periods that people are eligible for. So, so Bert and Benito, they just moved from up north, right? So they're moving states, so they're probably eligible for a special enrollment period. Exactly. So we should be thinking marketplace. Let's go ahead and start looking at these things. And they have how many days to do this? Yeah, it's not a ton of time. So like we can't super delay. And we talked about not rushing, but they should know that there's a 60-day window. And I don't exactly know from what day to what day that starts. Like
There's another thing too, it's like 30 days after you submit, then you have to do something.
there could easily be, you could know a bigger detail than I do. Yeah, it can get really complicated. You just want to be like working with them on those pieces. Yeah, I'm not sure, Alexa. Okay, great. So I love that you brought that up. And then you said,
Yeah.
we're talking.
Yeah,
Yeah.
we can talk about this some more. So yeah, like Laura said, that's how the conversation would start, because you wouldn't start getting into all the other marketplace stuff until you first screen them for a special enrollment period, make sure that's an option for them. And then you guys mentioned important stuff that's gonna come up in the initial questionnaire, which is the income, stuff like that. Do you guys want to tell them what you talked about regarding household size?
Yeah, so we were just talking about like where, like what would, who would qualify under that household depending on who's looking for coverage. So because Bert is looking for coverage, that would mean that they are involved in the household, and it's also important to ask if they have any like dependents within their
Yes.
household, because you want to make sure that when you're putting in the household number, their household income matches like that number, because it can change their qualifications for the primary tax credit. Right,
Exactly, yes. That's perfect. So that's a big thing that you want to make sure you ask towards the beginning is what's your complete household size?
Really quickly, it's premium tax credits. I just want to make sure everyone has, I've been hearing primary for some reason. Premium, yeah. Premium.
Because it's discounts on your premium, so premium tax credit. Okay, let's see what else here. And then what did you guys put exactly, or actually, before I ask all those questions, I'll have the other group
Yeah.
share, and then we'll cover what we don't cover between the both of you guys. So what did you guys get at?
We also talked about like how to be like self-employed. I'm like, it's very difficult. Right, I'm just gonna try to fill out that same application.
That's a great point about the income. but that's so difficult to calculate. And that happens a little bit more often than you think it would, where we're unable to have an exact amount of, this is what I make every year. And you just have to stress that it's extremely important that we get as close as possible and that we take our time to do that calculation and consider every kind of component that goes into the income. And we can also reach out to some resources or send them to the health department at that point. But it's also important to explain to your clients that this number, this estimate will really impact the overall cost of your plan. So we need to make sure we're as close as possible.
And I have fully been in encounters where I just sit there and kind of try and crunch the numbers with the
Mhm.
patient, because sometimes they're like, I have a kind of an idea of what I need per week,
Yeah.
kind of, and so we just sit there multiplying until we can get as good of an estimate as possible about what their projected income is. So yeah, you have to do that too. And a good point too, because what I was thinking when you brought that up is like, sometimes what they're making up north might be, like, the actual numbers for qualification might be different based off of what incomes are up there. So that's why a lot of these things are based off of projected income for the year, because that's going to change, and so they kind of have to adjust that estimate in their minds, be like, what am I actually gonna be making post-move here? So that I can give them a good and accurate number. Does that make sense? Yeah.
Can you ask to like refer to their like previous tax documents where they list their income?
Ask how, like, ask,
Just be like,
suggest it as a way to get an
yeah.
estimate? Yeah, you could, for sure.
Yep.
Um,
As long as they're working a similar job, right?
okay.
Or like the same job. No.
and make sure, like, ask them if anything, if there's been any major changes and stuff like that. But yeah, that's a good point too.
Mhm.
Okay, and then what did you guys, oh, a really good question came up is whenever they tried to add insulin to the thing, a bunch of different insulins came up. And then you're like, which insulins do I put? So definitely try and first ask the patient, do you know what your dose frequency is for this medication? But if they don't, what I said to do, I don't know if you have a different opinion, Zara, but like check all of them or like as many as you can to see, to make sure you can like kind of see how it varies across. I think with insulin, there isn't gonna be crazy variation in like which plans are presented based off of that prescription. But yeah, I would check all of them or as many as possible, if they have no idea what their dose frequency is.
I like that idea.
Yeah.
What about the silver plan? Did that come up?
Oh yeah, we talked briefly about that. We were talking about like what those categories like actually mean and the fact that you can filter for them on the actual thing. And then that led to our conversation about how the first thing I usually ask a patient is, what experience have you had with health coverage? What insurance have you had in the past, especially when we start talking about marketplace stuff too, because that can be like a initial great indicator of what their needs are, just knowing what they've been covered by in the past. So in this situation, they have very specific kind of things in their head. They know that they're covered by a silver plan. They know that it worked well for them. So if you wanted to try filtering for that, you definitely could. And yeah, I think that's what it comes up. So did you guys have any questions about that?
One more thing I'll add is, how would you, and we were talking, this will lead into our next group, but how do you, ask the client that you're working with about the select all that apply options, those 4 questions where it's like, you can receive employment, employee covered insurance or Medicaid. And then the second one's like legal parent or guardian of someone under the age of 19, pregnant, and then tobacco user. Like, how do you ask those questions to people when you're filling out this questionnaire? What are some ideas you have?
Can you just like give them the computer and be like, would you like to fill this out like privately?
Yeah.
Or like, I don't really.
Yeah, I mean, I think handing them the computer is great, or like at least just moving it, making sure it's of course in the center, obviously. But yeah, it's just questions at the end of the day. So I think it's important to know exactly how you're going to approach it and try that out so that you're not super awkward the first time you do it. And none of this you'll do for the first time on your own, but it is important to just directly ask the questions, right? Okay, so are you covered by Medicaid or I can't remember what the first one says, whatever the first one is. Like, do you receive this? And they're like, no. Okay. Are you pregnant? No. Okay. Are you the legal parent or guardian of someone under the age of 19? No. Okay. Do you smoke tobacco? Yes. Okay. So let's see. So this is the requirements they're saying for tobacco. So just like be straight to the point. And then, of course, like Alexis said, just you can also offer the computer. Same thing goes with asking in the first place if they want to fill out this questionnaire, right? We don't want to just jump in and be like super giddy to like go on the window shopping tool and start using the marketplace when our patients have no interest in doing that. And that's actually something that comes up a lot. Not because maybe they don't want to actually learn about it, but it's late at night. It's 9 o'clock, 10 o'clock, 11 o'clock. And we have no interest in doing it right now, right? So it's also important to ask for permission before you start doing anything. And then also suggest if you're getting some hesitancy or you're noticing it's a little late at night, hey, you can also set up a follow-up. I'm happy to bring you to the clinic next week. Or if you want to do a phone call that's better for you, or a Zoom call, we can also do that. I can email you this website so you can look at it on your own. And that is frequently what we do.
Yeah, I just had a patient, I walked in, her 3 kids that she brought with her to the clinic were like screaming for
Oh.
custody, and they wanted to go home. So, and she clearly did too, so I was like, but she wanted to talk to us, so I said, hey, how about I schedule you for our virtual clinic, on this date, and then we were able to do that. So, yeah, like Zara said, it's a clinic that's operating at night, you know, we don't wanna push people, to make it like, but if they wanna talk to us, we have to continue that conversation elsewhere, you know?
Let's move on. Okay, so this was the second scenario. Alfreda, 60, is a single woman who lives alone with no children. She has recently suffered a fall in the past year that left her with a broken hip and copious medical bills. She's employed, but her employer does not offer health insurance. And because Alfreda had to take so much time off to recover, her household income this year is estimated to be $18,000. She has an in-home nurse and needs her home health care to be covered, which she receives from UNC Home Health. Alfreda also needs the following prescriptions covered: Vasotec, Detroil, and Humira. And I was telling y'all, I am not a pharmacy person. I don't know any of these drugs. I think I've heard Humira on like TV before, but point being is that these look like name brands, right? So that should also be something we're thinking about. But let's go ahead and start thinking about the scenario. What did you all have?
So, first thing that caught our eye was the age not eligible for Medicare, because she's under 65, herself didn't have the illnesses that were eligible.
Mhm.
We moved on to her income. She doesn't have any dependents, she's not living with anyone. So that would be we could use that estimate to be a pretty good estimate of her premium tax credit. And we use that to look at the plans. And we also have to take into account the drugs that are listed under. We also saw that she is probably going to be busy with the doctor a lot because of the broken hip and medical bills. We wanted a plan that was probably either silver or higher, because that one would have, it's still a pretty high premium, so with the tax credit, you know, probably less. And that one would be better for illnesses where you're seeing the doctor frequently.
So I think y'all ended up pulling up some plans, right? What was that first plan that was like $7?
It was the Blue Home Silver Standard, and it was only $7 with the tax credit for the premium and $0.
Yeah. So it looked like that silver plan might have been a good option, but what do we not do? Yeah, we don't push on her. We just show her the options. Okay, awesome. Great points here. Do y'all want to add anything on the next group?
Yeah, I think some things that we were planning to know and we had asked before, so it's the priorities with coverage, price range, what other medical services she having. Experiences with insurance and for financial assistance and how much of
Yeah. No, great points. Basically just try to get the feel, right? And a lot of what you do in the beginning, I know we're giving you a scenario and we're telling you to come up with a list of questions and like start problem solving, but a lot of the first moments of your interactions with clients is listening, right? It is asking open-ended questions, allowing them to tell you their story, and then picking up on those cues, but being a really active listener so that you can get that information or know kind of where we need to get more information. Yeah.
Are there any obstacles that might be to get a coverage plan, like
Oh. Well, sorry?
I don't think with felonies,
Yeah.
but there's like something that
I was gonna say, I think like.
Currently incarcerated.
Yeah, but I don't think that. That would be kind of whack.
I think
So-
actually that the ACA protects against that, I think. Yeah. Good question, though. Yeah, there's a big one. Tobacco use comes up. We already mentioned tobacco, use, right? Okay. Do you know what it is? Mhm. Yeah, it is. Because that'll affect if they can get premium tax credits or not, which then completely will sway their costs. We're gonna have a whole session dedicated just to what do you do when we are working with our clients who are not citizens or are not legally, what is it? Legally LPR?
Permanent.
Legally permanent, legal permanent residents, yeah, LPR. Yeah. So great question. We can't always use the marketplace on with a lot of our clients, and honestly, I'd say like 93%.
Yeah, a lot of the taxation population that we're gonna be dealing with do not follow the guidelines of control of residents.
Mhm.
And so it makes the process of kind of ruling things out kind of simple. It limits their options, obviously, but then immediately, we're not able to walk them through the marketplace and stuff like that. So that's the first question that comes up really, and not the very first thing that you should be talking, like, don't walk in and be like, are you a citizen? Please don't do that. But it's one of the first things that come up because it's like a major thing that that's how we guided us. So great thing to bring up, and we're gonna be talking about that in detail, in the last training.
And questions like, can you tell me about your previous health coverage history? Help you to extrapolate information that you need, right? If they say to you, yeah, I mean, I had health coverage in my home country, but I just got here, like 3 months ago and I'm now living with my sister, right? Then we've already kind of extrapolated, okay, maybe we're not looking at some of the options that we were thinking.
And then once you do get those indicators, you still shouldn't assume any sort of situation. You still want to ask and clarify,
Mhm.
like, are you legal resident, things like that. But yeah, definitely don't open with that. You gotta frame it in a way to where they feel like they can trust you with this information, because a lot of times they are hesitant because they know that a lot of times, like, they're not in a space where they would be able to share that openly, but with us, they are, because we're literally just here to help.
And we can state that we don't have anything to do with the government, and citizenship. And I mean, I guess we do have something to do with the government, but we work we don't have anything to do with that. We are just here to help them with their circumstances. And this is a confidential conversation.
And sometimes too, because of like a language barrier or some other reason, like they do think we're trying to sell them something for some reason. So I've been in situations like that, like, oh no, I'm not looking to buy anything. I'm like, no, I'm just a volunteer. Like, we're just here to help. You want to make that very clear at the outset, so that they understand like what you're here for.
Yeah.
Um,
Okay, let's talk. Oh, was there a question?
or questions?
Yeah, I was gonna ask about.
I've never dealt with that situation.
It's not come up at least. And I know financial assistance, which we will talk about, is like kind of our like lovely catch-all, and we're so grateful it exists. Will not like have a issue with someone receiving coverage. So financial assistance is usually our like last go-to if we know that there's like other holes with
But that would
Medicaid or
definitely be
Marketplace.
the type of situation where if you didn't know the answer, you try to go find that answer either by reaching out
Mhm.
to another agency. that-
Call them, yeah.
Call someone.
Yep. I mean, we said this, I think, on our first training, but we are the name of the game is being a problem solver, finding resources, working with your client. It's an alliance that you're forming to kind of get them where they need to get. Okay, let's talk really quickly about scenario 3. I know we're short on time, and then I think we'll just move some of our stuff from the 6th module, which is honestly, personally not a favorite of mine, and I have a lot of issues with it. And so I was gonna tell you all about those issues, but maybe I can spare you before break and we can come back and look at it next week. So let's talk about scenario 3. Cassandra is a patient at the clinic here. She's coming for her persistent headache. She is the mom of 2 children who are under Medicaid. They have Medicaid coverage, and she does not have insurance, and she doesn't think that her employer offers insurance, although she's not sure. She doesn't want anything too fancy is what she says, but she knows it would be nice to have coverage so that she can see a doctor. And a friend of hers mentioned that she should maybe look into a health savings account so that and she'd like to know a little bit more about this as well. And then she finally mentions while you're talking to her in your conversation, maybe you're asking her about the kind of health services that she wants covered. She mentions that she's trying to get pregnant as well. Okay, go ahead.
So the first thing that we discussed was talking about how she can check with her employer about insurance coverage.
Yeah.
Then any way that she can contact with get that information.
Yeah.
Before she moves on.
Big. Mhm.
What her employer can not
Mhm.
tell her that she can get.
Mhm.
Versus what she can decide of that.
Mhm.
The next thing we were gonna ask her is, so her two children are already covered under Medicaid, but does she want to continue with them? To stay in Medicaid,
Mhm.
does she want to add them to her plan? Does she
Mhm.
want
Mhm.
and then I think the lack of information here is what it was, so,
Mhm.
it's a spouse.
Mhm. Mhm.
And one,
Mhm.
are
Yep.
health or the dental,
Mhm.
how much she might.
Yep.
So,
Yeah. Yeah.
And then also she mentions that she wants to see her doctor, so that she's looking for a specific doctor in her network,
Mhm.
that she could go to.
Mhm.
And then also, we would, show her the laptop and like go through like, the actual filters and see, like citizenship status, tobacco use.
Yeah.
And also as mentioned, like income, and then also, I guess.
I'm
also
listening,
in
I'm sorry.
terms of, like nothing being like too fancy, if she looking for just, health insurance or health and dental.
Mhm.
Um,
Yeah. And then what about, does this group, on the back row want to add how you would explain an HSA? Oh. Mm-hmm. 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 Yeah. I'll pull it up really quick, but, so an HSA, yep, it's attached to a plan typically, exactly. Do you know which type of plans it's usually attached to? It's usually attached to those high deductible, high deductible, what is it called? High deductible health plans, which are high deductible, low premium. Right? So we talked about that last week, which is like, it's a good option sometimes if the person who's looking for coverage knows they're not going to the doctor that often, right? And they kind of just want something that's cheaper every month and they'd be willing to pay a lot more if they had to use it. Great. And then let's see, and you said eye care and dental care. What about when Cassandra mentioned that she wants to get pregnant? Mm-hmm. Yep, exactly. So she might be eligible for Medicaid. What am I doing here? Oh, this is the child. She may be eligible for Medicaid, exactly. And the Medicaid income, at least right now, it's going to change with expanded, but pregnancy Medicaid, I think, is at 200 FPL. So it's significantly more for adults than like the 30% FPL that it is usually. So oftentimes people will be covered for, at least people that we'll see in the clinic are going to be covered with pregnancy. Now, there is a caveat that they have to, I mean, as there is with everything, there's loops to jump through. And so they actually have to go to a doctor and get a pregnancy test and get that sent over to the Medicaid office. I mean, there's lots of steps, and pregnancy is something that you can't wait for, right? It will move with or without you, right? And we recently had a client who came into the clinic and definitely needed coverage and was pregnant, and we just had no time to waste. So you have to kind of move on things when it comes to it. Yeah. Yeah. Yeah, that's a good idea. And maybe when, like, personally, I think pharmacy is not our expertise, But if you have a specific interest in it or you have some information, that's great. It's always a good idea also to refer. We have a fantastic pharmacy team. And then we also have people who work on Medisys. They're called the Shack Map team. I think we mentioned the Medicaid assistance program. So lots of people who can help us with the prescriptions for sure.
So. Like when they have the baby, is that like, once they have it, are they not eligible for Medicaid or do they have to little time after they give birth?
Yeah, well, now with expanded Medicaid, it's going to cover up to 1 year postpartum.
And I was about to say also with Medicaid expansion, this effective December 1st, you know, you're gonna be able to just ask her about her income, regardless of whether she has any dependents that she.
Or
is
pregnant, yeah.
taking care of or is pregnant.
Yeah.
So the whole conversation around Medicaid is completely gonna change a little over a month from now, so.
And we're gonna get Dr. Studer hopefully to talk to you all about that. But with the pregnancy, the other thing to know is that UNC Financial Assistance will cover that as well. So basically, we should never, right? And I want to stress this, we should never encourage someone to not receive health coverage because of a financial barrier. Okay, ever.
Actually, can I know we're over time, but I'd like to quickly say this last night. I was following up for a long time with a patient and he called me last night, okay? And he was like, hey, I need your advice. And he said, he was like, my doctor wants me to do this colonoscopy. I haven't heard back from financial assistance yet. I don't know what to do, okay? And so basically I probably said like over 7 times on this phone call, I was like, your health is the main priority. You should never, if something is medically necessary, like your coverage or trying to wait on to hear back from someone should never be your like main deciding factor. You guys should also know that I did not advise him one way or the other. I did not say, go get that colonoscopy or otherwise. I kind of talked to him about how, we'll talk about this in the future, but I said UNC Financial Assistance works retroactively, things like that. I told him all about it. But yeah, he had a healthcare need, he was going to hold it off, and to hear back so that he knew he could afford it. But at the end of the day, like whenever they're recommended things by their doctors and stuff like that, like they should be putting a lot of weight on, getting procedures done that are necessary, things like that.
And they
So-
should go straight to the financial assistance officer in their doctor's office. And we'll talk
Yes.
about that as well, but I just wanted to put that out there. Just never, so like we had someone who came in, she was having bleeding, she was pregnant, trying to decide if they should go to the emergency room or not because that's a cost. And I was like, please, please go take care of this. Was there a question over here? No, okay. Just really quickly want to show you all on the summary of benefits and coverage at the very bottom. So you all get familiar with these and looking through it and seeing the services. But at the very bottom, there is this really helpful coverage examples. This is not exactly what the costs are going to be, but it's just a nice thing to look at because maybe Cassandra wants to look at these plans because she wants to know what would the cost be like if I did have a baby under this plan. And so these breakdowns can actually show you where all the numbers will go and eventually what the total cost would be. And it just shows you every plan is the exact same. So every plan will break down their numbers for having a baby, diabetes, and something else I don't remember. But that can be a helpful tool as well for a fracture. Okay, so that can be a helpful tool as well to look at. Do you have a question? No, okay. Okay, great. So let us just call it there. Let me exit out of this and make sure that there is, so we're gonna cover these slides next week. We didn't have too much else for you all on the group discussions, because we did that in our talking today. But just think, I hope that being here and these training sessions has either affirmed for you why you want to be a counselor with us or volunteer, or maybe even giving you a stronger reason for becoming a volunteer. And I know that everyone here wrote down those reasons when you apply, right? You sent us your little application. So I think this is a great time. We're about halfway through, a little bit more. Just think about those reasons, reflect on that, and see if anything's changed for you. I know for myself, if you have every moment that you were a part of it, we kind of get that renewed. And hopefully you feel that way too.
Thank you guys so much.
Have a great break.
I liked that.
Yeah, it was fun.
An idea with the practice.
Yeah, why is he